what is pain perception by the brain, and how can that affect our response to an injury or a trauma, irritation, inflammation, etc. And I think one of the easiest ways to explain this is the way that our brain perceives our pain. I hate to say that all the pain's in your head, because it kind of is all in your head, but in conjunction and cooperation with these sensors and different tissues throughout the body, the brain perceives threat, basically. So your pain response is a response to, in a lot of cases, a threat level. I'm going to give you an example. I've used this before in another video that I had done, but if you fracture your arm or your leg and the bone's sticking out of the skin, you're bleeding and all kind of stuff, right? Like, pretty traumatic. You're in a lot of pain. That's a 10 out of 10 pain, right? And on a pain scale. And so you go to the ER and they take care of you, whatever. Maybe you then follow up with an orthopedic. Well, I guess you would follow up with an orthopedic, and then the orthopedic maybe operates and all this kind of stuff, right? And I see you a week later, or even 2 weeks later, whatever. And I say, okay, do you still have the same 10 out of 10 pain that you had when this first happened? And you say, well, no. It still hurts. It's achy, it maybe throbs or whatever, but not a 10 out of 10 pain. And why would you not have the same pain? Because the bone is still fractured, it's still broken. Even if they do surgical repair with internal fixators and plates and screws and all this stuff, it's still not completely healed, ossified. So that is because of your brain is perceiving less threat from that injury. When we were kids, right, and you fall down, you get hurt, you want your mom or your dad or your grandma or your aunt or whoever that is that you find comfort with, and you go over there and they kind of hug on you, love on you, and then kiss you, boo-boo kind of thing, and then you feel better, and it doesn't hurt as bad. And that's because there's a level of threat that goes down from the brain, so that pain signal, the volume of the pain signal goes down. So sometimes, or I say sometimes, actually a lot of times in therapy, especially orthopedic-based therapy, what we're doing is we're trying to turn the volume down in a lot of cases. There are things that we're doing biomechanically from a histological standpoint from the cells, where you're trying to improve cell healing and speed and all these kind of things. Try to decrease this inflammatory response or increase it depending on what your goal is. But at the end of the day, we need the brain to kind of calm down a little bit and allow us to perform certain movements, exercises, activities, those kind of things, to basically recalibrate the brain to see, it's not so bad. If my neck hurts and I look up or I look down and, man, that really hurts, or if I extend my back and that hurts in my low back. And so what do? We avoid going into those movements. We avoid that extension or side bending or whatever that is. And then the brain, it doesn't take very long. The brain learns, well, wait a minute, you shouldn't move past this range of motion, because now for a while you've not been moving past it. And so if you try to move past it, that volume is going to go up significantly. Even if there's no more mechanical damage being done, even if the disc is pushed out or the tendon is there, irritated, even if that is no worse, if the brain perceives it as being worse because you're moving out of what's been your normal movements for a while, that pain is the volume is going to be turned up, and you're going to be, man, I can't even bend back now. It's gotten progressively worse. So a lot of people will think their condition's gotten worse, and a lot of times it's not any worse. It's just that pain perception is worse. Now I'm not minimizing the fact that sometimes, yes, the inflammation is worse, or yes, a disc now is completely out of place, or meniscus is torn, whatever that is. But in a lot of cases, if you can buy yourself a window of opportunity by desensitizing the brain a little bit, kind of confusing it, so to speak, or confusing those signals that are going through, then that offers windows of opportunity for progression. You can the brain can be easily tricked, but it's not easily fooled. You can temporarily trick it, but then it says, wait a minute, no, I'm not going to fall for that. And then it becomes more difficult. Sometimes people that pop their joints and they get relief from popping those joints. And you may notice the more that you pop your joints, the more you need to pop your joints, because you become desensitized to this. It turns into like a white noise, so to speak. So that's kind of like just touching on pain perception. So it does not always, and this is kind of cliche, and this has been said a lot, hurt does not always equal harm. I mean, in a lot of cases it doesn't. Now, as always, make sure you're checked out by your healthcare provider to make sure that you're okay to progress with those types of things. But like I said, a lot of times It's just because we're avoiding things and we're not moving into those movement patterns, and that's why we have the issues that we have, and that's why it never gets better, and that's why it progresses. So that's just something to consider. That's why I'm a big fan of the McKenzie method, McKenzie technique. So that technique is phenomenal, and like I said, there's tons of research to support it. So if you get a chance, look that up, go on YouTube or just Google it, the McKenzie method. I think you'd be pretty impressed, because there's also a lot of ways that you can treat yourself at home. They actually have books called Treat Yourself at Home. So I'm not affiliated with McKenzie at all. I'd use their techniques, but just kind of something that you can check out that, like I said, is very beneficial, that works really well. So I hope that helps, guys, and thanks so much for watching.